And it's a success made in Western and southwestern Sydney. All LGAs across the state's Delta outbreak epicentre today passing the 90% first jab milestone. Camden's absolutely smashing it, with nearly 90% of its over 16 population double dosed. But it's been a hard road. Starting in Bondi in June, the outbreak only really caught fire as it spread from the east in July.
In Western Sydney and southwestern Sydney, we're at a point of crisis.
That crisis fuelled by larger households comprising more essential workers.
They're the people that keep us supermarkets stocked, they're people that are working in food processing and other settings.
In terms of restrictions, hotspots bore the brunt. Regular compulsory testing for essential workers required to leave their LGA, causing mayhem.
So not only is it just impacting on those workers and general residents, but now it's the entire community.
And while scenes like this played out in Bondi,
thousands of additional police will be in and around the 8 LGAs.
300 ADF personnel to ensure there is maximum compliance when it comes to the current public health orders.
The city is almost ghost town. There's nobody there because everybody has complied.
Sadly, they paid the highest price, with 60% of the state's deaths during the latest outbreak occurring in Western and southwestern Sydney. The way out was clear, but in some of Australia's most diverse areas, language barriers and poor messaging hindered the vaccination push.
Southwestern Sydney and parts of Western Sydney have some of the lower levels of vaccination coverage, which poses another challenge.
Now they've risen to that challenge, soaring past 80% and driving up the state's total, opening the door to freedom for all Sydneysiders.
Well, Dr Jamal Rifi's done more than his share for the community of Belmore, and he joins us now. Dr, Western Sydney was well behind on vaccines. Now you are right out in front. What was the key to turning things around?
Without any doubt, it was public education. Talking to the people the language they understand and giving them the information in multiple languages so we can encompass the whole members of the community. We had a patient who's been nearly in ICU, but not there. And he was able, in his own language, an unscripted video that to record it for us, and we disseminated that to the community. At the same time, we conducted a massive campaign, radios, community radios. We had to dispel many myths. We needed to actually spell the lies out. We needed to talk about the science of the vaccination, and we needed to talk about the safety and efficacy of the vaccine and countering everything that was, unfortunately, in the media, social media in particular. We issued an open letter signed by 25 different doctors from different speciality. And we said, you entrusted us with our opinion about your health in the last 25 years. How about now you trust us with the vaccine?
So much hard work by so very many people. But Jamal, I think it's important to acknowledge your direct role as well. You postponed your retirement. You set up a testing clinic in your front yard. You turned the car park of your surgery into a vaccination hub. What drove you to do all of this?
And we did also the first drive-through vaccination with the Canterbury Bulldogs. We needed to find out what actually works for the local community. Some people were concerned that going into an enclosed space might put them at risk, rightfully so. So what we did, we opened vaccination clinic in the open space. We actually worked with few local organizations to find out who is at home, who is unable to attend the vaccination clinic. So we went to them and we vaccinated them. But most importantly, as I've said, it was the education.
Doctor, I get the feeling your retirement is going to be pushed back quite a bit with all this good you're doing in the community.
We've done well, but we're not out of the wood yet. That's why I can't go on retirement. That's why my motorhome is still in the driveway of my house.
It's a real triumph of community. Congratulations to you and really all the people of Western and southwestern Sydney. But I can't help think back to that period in early August where clearly a lot of people in the community, in that community, felt like they were being discriminated against, that people in the eastern suburbs were getting much better treatment. As you kind of come through this, have those wounds healed, or do you feel like that those grievances are still there?
Look, definitely we had that feeling of actually a city of two towns. We felt that the lockdown in our area was very harsh, but in the different suburbs, it wasn't a lockdown at all, it was a mockdown. Recently, after we opened up, That sense is changing. I've seen yesterday many people attended the hairdressers, and including myself, of course. And I've seen many people went for, some shop therapy. And it did work. We couldn't go to the beach. Unfortunately, the weather wasn't helping us in here, but hopefully the week after we will.
Well, thanks so much for all your hard work and all the best with everything from here. Thanks for your time, Doctor.
Thank you all. Thank you.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.